World COPD Day. The theme for World COPD Day 2023 is Breathing is Life, Act Earlier. World COPD Day is a global healthcare event to raise awareness of chronic obstructive pulmonary disease (COPD) amongst the general public around the world. It has been observed every year on the third Wednesday of November for the past 20 years since 2002. This year, November 15th is COPD Day with the theme Breathing is Life, Act Earlier. The focus is on early attention to lung health and timely identification of COPD. COPD is the third leading cause of death globally and its prevalence is increasing. It leads to breathing difficulties and is often caused by air pollution. While incurable, COPD can be managed with treatment. The severity of COPD affects life expectancy, with more severe cases having a greater risk of complications. Warning signs of COPD. Warning signs play a significant role in early diagnosis and treatment, which includes difficulty in breathing, cough with increased mucus, that is yellow or green colored secretion, fever with chills, increased fatigue or weakness, sore throat, unusual headache, and nasal congestion. Risk factors for COPD. Smoking is the major factor for chronic obstructive pulmonary disease, which includes bronchitis and emphysema. 85 to 90% COPD cases are caused by smoking. Compared to non-smokers, female smokers have a roughly 13-fold risk of dying from COPD, whereas males who have smoked regularly have a nearly 12-fold increased risk. In addition to this, the risk factors are family history, alpha-1 antitrypsin deficiency emphysema, a rare form of COPD that is caused by a genetic condition that affects the body's ability to produce alpha-1 protein, which protects the lungs. Evidence of previous childhood respiratory infection, that is medical history. Then exposure to second-hand smoke, workplace toxins, chemicals, dust and fumes, and air pollution. Preventive measures for COPD. Smoking is one of the important factors in COPD. To reduce the burden of COPD, various government schemes are implemented such as restricting cigarette sales, increasing tobacco prices, lowering nicotine content, banning smoking in public places, etc. The various other preventive factors that can be implemented individually are avoidance of passive smoking, avoidance of exposure to air pollution, being cautious to avoid exposure to harmful toxins such as chemicals, dust, and fumes. Occupational exposure prevention by improved indoor or outdoor air quality, reduced cooking, cleaner stoves and chimneys, etc. The importance of World COPD Day. Over the last 3.2 decades, the number of prevalent cases of COPD has increased by 974 lakhs. A study conducted in 2019 assessing public interest in COPD between 2004 and 2018 reported that COPD was highly underrepresented relative to its prevalence and effect on global health. This can be overcome by providing public awareness with regard to the disease and its symptoms and treatment, thereby improving the patient's quality of life. Awareness of COPD risk factors may also help reduce the disease prevalence. In addition to this, this raises the awareness of the dangers of air pollution.